honorable leaders, respected judges, and my dear fellows. Good morning. So, today I'm on this big stage to represent my topic to you, and the title of my topic is Mendelian randomization find no causal effects between ADHD and omega-6. So today we will study what is omega-6, what is ADHD, and how the relationship will be between them. So before going forward, I would like to introduce myself. As we can see that my name is SABOOR and I am doing masters in pediatrics, and I belong to the International School of Zhejiang Chinese Medical University. So let's go with the content. As you know, the content is like the formal content which we do have. But before going to the content, I would like to introduce about my topic. So let's go with the ADHD. Many of you might be heard the terms which is called ADHD. The full term is like attention deficit hyperactivity disorder. Well, this disorder is really common in boys as compared to girls. And secondly, like it can affect 5 to 10% of the people all over the world. And it is really common neurological disorder. So now, as you get the sketch of ADHD, but now let's go and see why we conduct this study. Actually, this study belongs to the arachidonic acids. In this we have omega-6, in which we will find the relationship between them. Now, what is the Mendelian randomization? Actually, Mendelian randomization is an advanced technique which we normally use to draw the drawbacks of observational study. So let's go and see the research background. In the research background, we can see the purpose. As we already know from the topic, the purpose of this study is to find the relationship between ADHD and omega-6. Now, we use the MR method for it. And the findings, in the findings we found that the SNAPs were 0.94, which is a positive result. Now, we will see how we are going to find it. So, let me give you the background. As you know, the background of this study is like domestic research. I will take domestic research as Chinese research, and this is like international research. So the research about this topic is very less, the topic which we are going to do. Now let's go with the methodology. So from methodology, we will start from the point 1. As we can see, we just find a control group which consists of 35,000 patients and the case group which consists of 20,000 patients. Then we do the European sample, like the population was the European sample. And then we go to the procedure of the clumping procedure. And after clumping procedure, we just go to the Mendelian randomization. Now, we will find how we conduct it. As from this flow chart, we can find that exposures, outcome, and confounders, they are crossly linked and closely linked for this clumping procedures. Now, the study design. Actually, the study design is like, we just take the method which is called Mendelian randomization. And after the Mendelian randomization, we take the European population, and the case control was more than 20,000, while the control group was 35,000. And for analysis, like we use this formula, and we will see in our results how this formula works for us. Now, let's see the results. As we can see the result that the p-value is significant for the weight median and inverse weight median. So this provides a strong background for our research that there is no causal relationship between omega-6 fatty acid and ADHD. Now let's go with this research. As here we can see that the point didn't cross the 0 point. So we can say that there is no significant relationship between omega-6 fatty acid and the ADHD. Now in the second result, we can also find that the plot between the two samples is also not a strong directional. So this also rejects the hypothesis that there is a relationship between omega-6 fatty acids and ADHD. Now let's go with the discussion part. In discussion part, now I will compare my studies with the one which is already published. In my study, I believe there is no potential treatment significance between omega-6 fatty acid and ADHD. While I can also believe that at the age of 7, as we know that most of the population was a European population, there was no significance there. But the other studies, they say that omega-3 and omega-6 play a vital role to decrease the symptoms of the ADHD. Now we will prove it how it do. And this is how we find on MR randomization that there is no effect between them. And we also suggest that the excess intake of omega-6 might play a vital role to increase the symptoms of ADHD, not decrease the symptoms. Let me give you a small highlight box. What we do, we just find a key procedure, Mendelian randomization, and after the Mendelian randomization, what we know about this topic, we already know about omega-3, we already know about omega-6, but we don't know about that there is any relationship between ADHD and omega-6 fatty acids. Now let's go with the conclusion. In a conclusion, I will say there is no therapeutic effects between omega-6 fatty acid and ADHD, and we can also conclude that excess of omega-6 is a potential risk for the ADHD. And of course, we know that if your work is genuine, your work will be published. So this paper is already published in World Journal of Pediatrics with the impact factor of 7.8. So that's all for today. If you have any questions, feel free to ask me.
Thank you very much. 有时还可以问一下问题。
Thank you so much for the presentation. I just wanted to find out why you want to use omega-3 and 6. What prompted you to use those chemicals?
You mean like why we use omega-3 and omega-6, right?
Yes.
Actually, omega-3 and omega-6, they are the supplements. Many clinicians or doctors, practitioners, what they will do, they will use it for the treatment to reduce the symptoms of ADHD. For example, we can say that omega-3 is found in fish oil, so we can say like we normally use to give it to the patient to reduce the ADHD symptoms. But what we found is that omega-3 might play a role, but omega-6 have no causal effects between ADHD and the symptoms. Any questions?
Okay, thank you very much for the presentation. So I have a question. The question is that how did you select your instrumental variables that you use to do the MR? And also, did you test for pleiotropy? And what methods did you use to test for pleiotropy?
Actually, for the instrumental variables, we just found that the severity of the symptoms was there. For example, when I was selecting the instrumental variables, there was two options for me. The one was severity of the symptoms was too much. The other one was moderate. So this, like for instrumental variables, I just choose the severity of the symptoms for there.
What I mean is that usually when we do MR,
Sure.
In the selection of instrumental variables, we select instruments of genome-wide significance,
Yeah.
which is 5 times 10 to the power minus 8. And also sometimes we perform the F test, and also we look at the correlation. Because when you don't do this, the instruments are biased. Also, we do sensitivity analysis where we do the MR-EGA and the MR weighted median to test whether there is pleiotropy. So if this thing is not ascertained, you can see that your MR estimates will not be actually correct. So this is what I wanted to ask.
Yeah. Actually, it also depends. Like for example, when you are doing MR do have a lot of sections over there. Like for instrumental variables, you also get like genome weight and situation, which we can call as Gavas and SNAP. So if we correlate them together, for example, like your studies was also MR based, right? Like I saw your PVD over there, but that MR base versus this MR base, actually we do have a 2 MR base up there, for example, which we had the exposures outcomes. So we just selected the exposures outcomes over here.
Yes, you know, in MR there are 3 major assumptions,
Yeah.
which means the Z must be reliably associated with the X, which is the exposure. And also the Z must not be associated with the outcome except through the exposure.
Yeah.
And also there must be not residual other compounding or measure compounding. So based on these 3 assumptions, we put certain measures in place to ensure that instruments that are actually selected to do this MR meet this criteria. This is what I was asking.
So in our, we also did the same. Like, did you saw that diagram in which we like, let me show you again that diagram here. Okay, thank you guys.
For the next speakers, when you answer questions, please just stand here because the microphone is here. When you're away from the microphone, we cannot record your answer. That can be very important. You know. You want to steal your secret?